job is hardcore.
There's all sorts that can happen.
Everything we do relies on this bond between us all.
Just stay down. No.
You're okay, you're okay.
You have to be comfortable in high-stress situations.
Save a life, and you're a hero.
You're in the hospital.
How much? Do you want to tell me what drugs you want to win?
Save 100, you're a nurse. In Australia, 1 in 10 nurses hails from the United Kingdom.
It's a bloody good job. It's so good.
Big deep breath in.
Through their eyes, you'll see life.
Push.
The girl!
Death.
Unfortunately, we can't save her.
And everything in between.
Coughs, colds and sore holes.
Welcome to the front line.
2, 3.
Of one of the world's toughest
It's all right, darling. We're looking after you, okay?
and most trusted professions.
It was scary, hey?
Nurses are superheroes, without capes, just in scrubs.
I became a nurse when I was 17, and I knew that I didn't want to work on wards and that it was probably going to be theatre for me. I've always been a caring person, so to be a nurse, it's just been easy.
At the Mater Hospital, nurses Megan and Phoebe are clocking on for a busy day in surgery.
Hi, Santia. How are you? I'll just get gloves out.
Megan and Phoebe are part of the highly specialised vascular surgical team,
I'll make up the stay line.
most often unblocking and repairing veins and arteries.
They sometimes call vascular surgery the plumbers of the medical world because we clear out your arteries and your veins. Sometimes they can get blocked. So Steve's our head vascular surgeon. So it's 7:30. He usually arrives around this time. Sodium chloride, May 23.
Phoebe's a scrub nurse and Megan is the team leader.
All right, what have we got on today?
Vascular disease affects 1.2 million Australians.
We're just going to leave the belongings and they'll get sent down to...
One of them is Tony.
Well, I have blocked arteries, actually. I sort of found about 18 months ago, just walking on a slight incline and on the road, and all of a sudden I found that I had a pain in my leg. Now I'm filled up with plaque, and from what I understand anyway.
Tony could barely walk when she was admitted. There's a danger the artery in her leg could become completely blocked.
I'm a bit apprehensive, I'm a bit scared. Unfortunately, with operations, things can go wrong sometimes, and you can have complications, so.
Hi, I'm Phoebe. I'll be your scrub nurse.
Tony has a blocked artery in her leg, and so what we're hoping to do is restore the blood flow to that artery so that then Tony will have a lot less pain in her leg.
Surgeon Dr. Stephen Dubenek arrives. A week ago, he identified an artery in Tony's leg that was 75% blocked.
So we're going to go and puncture your right groin, find the narrowing, and then we're going to do a thing called an atherectomy, and we're going to take out some of that plaque, and then we're going to balloon it to make it nice and smooth. If we need to, we'll put a stent, but hopefully we don't need to. Are we ready? All right.
So what's happened to you today, mate?
It's footy season in Sydney.
Yeah.
And that means another busy weekend for the emergency department.
I just got jacked for a clavicle x-ray, if I can, please.
More than a third of all sport-related injuries in Australia are sustained playing all types of football.
I was playing rugby and got tackled and landed on my elbow.
Shoulders rank #1 for breaking or popping.
It's broken.
In terms of like stuff we see in emergency, there's no predictability in your shifts. Oh, this guy. Okay, I'll walk him. Fast-paced, bit chaotic. From the red, please. I'm going to get intranasal fentanyl for the guy next door. Emergency is all about teamwork. Everything is about teamwork. Happy days? No worries. Hey, man. Do you want to come with me?
Nurse Ewan is treating his first weekend warrior.
Do you want a wheelchair?
I feel a little comfortable on my shoulder when I just lean straight down.
Okay, all right.
Young Daniel is fresh off the field with a clearly dislocated shoulder.
I don't think you want to be awake for it when we pull your shoulder.
I love it when it goes back in.
Do you like it?
The feeling's unreal.
Okay, no worries.
Patients are usually sedated to have a shoulder put back in.
Doesn't need the sedation then. He just wants nitrous.
But this is Daniel's 4th dislocation, and he's elected to tough it out.
Big breath. Okay. And again.
Instead, he'll have a blast of nitrous oxide, also known as happy gas.
Nice and deep breath.
People that have had multiple previous dislocations, usually their shoulders are quite loose, which means that we can get them back in without much difficulty. So we try and use minimal amount of drugs, which means they can go home quicker, there's no side effect.
Keep taking those deep breaths. Try and relax the arm as much as possible. Shoulders back.
External rotation. That's it.
Oh, hold up.
Oh. Okay, arm down.
Daniel's shoulder is back where it's supposed to be.
Well done. You feeling okay?
It's like $1 million. All right,
Well
we're gonna put you in a sling, okay, mate?
Yeah. All right, pop time.
Happy gas is also an effective truth serum. Daniel's not promising to follow doctor's orders.
I'm sure this is going to come off as soon as you're outside the hospital, but this should stay on into the next couple of days.
Yeah, okay.
Just going to do a blood pressure, man. Before we send you out, make sure you're all good.
How are you, mate?
Good.
You all right?
Yeah, I'm feeling
What's the go?
It's back in.
It's back in.
Hello, how are you?
Back at the Mater, Tony's about to go under for her operation. A partially blocked artery in her leg means she struggles to walk.
My name's Megan, by the way. Hi, Megan. Nice to meet you.
To restore blood flow, they need to scrape out the plaque causing the blockage and widen the affected area.
Are you okay? Yes. Okay, good.
We have to wear lead because we're doing constant x-rays. So this is our very fashionable lead gowns. We need to know if there's been any bleeding, we need to know where the blockages are, and we need to know if what we're doing to that artery is actually working. So it needs to be a continuous x-ray.
This is the only type of surgery where the use of an X-ray is continuous. Limiting that exposure depends on how fast Dr. Dubenek and the nurses can get the job done.
All right, so we're just getting ready to go. We have Tony's right groin and we get a good idea of what's going on inside the vessel with ultrasound investigation. That big black dot in the middle that's pulsating is the common femoral artery, and you can just see there at the bottom, that's atherosclerotic plaque.
And here's where the plumbing begins. Dr. Dubenek will try to scrape and suck out the plaque with a minute probe.
And then it will pop, there's that vessel. We're inside, we have pulsatile flow, and we now can put our wire in through that needle, pull out the needle, and put the sheath over the top. This is our X-ray equipment, which is totally necessary for the procedure, to take pictures of the inside of the artery. And you can see that the sheath is gently being passed over the aortic bifurcation and into iliac vessels. Let's have 10 mils at 15 mils a second.
Fluid is injected to show contrast on the X-ray and give a clear outline of the vessel.
So here we go. Oh, righto. This is a little interesting. She's occluded.
The X-ray shows the blockage is now far worse than it was just a week ago.
It's completely blocked, as in there is no flow going down to the bottom of her leg.
Oh, righto. This is a little interesting. Where that arrow is now is where there used to be a narrowing of 75%.
In that time that Tony saw me a week ago, that is now blocked. It's totally occluded and blood flow is not going through that superficial femoral artery to the lower leg. And that's something that has only just happened and changes things dramatically. I just hate clot. Clot just makes everything so much more difficult.
St Vincent's Hospital is one of just 4 heart and lung transplant centres in Australia.
All right, you tell me when you're ready.
Each year, the specialised team performs 25 to 30 heart transplants.
Taking over gently, holding that volume.
But there are many more critically ill patients than there are donor hearts.
Patients wait on the heart transplant list for more than 300 days on average. And for these patients that are critically ill, that come in, that cannot wait, they will die. You never say no or this can't work. You find a way of making it work because you have to, because people's life depends on it. My name is Desiree, and I'm the clinical nurse consultant for mechanical circulatory support, or in layman's term, you can call them artificial hearts.
There's been no alarms, no problems with your battery charger, everything is good.
Yeah.
The left ventricle assist device, or LVAD, is offered as a bridge to transplant patients who would otherwise die waiting for the precious gift of a donor heart. Today, Desiree is meeting with 58-year-old father of 3, Giuseppe,
Hello.
who was diagnosed with an enlarged heart in 2008.
And I'm the nurse consultant who works with the mechanical heart.
Although he was fitted with a pacemaker 5 years ago, sadly, his condition has continued to deteriorate.
I was getting these symptoms.
Yeah.
Shortness of breath, uncontrolled coughing, uncomfortable lying down because I felt there was pressure on my lungs. So I was not very comfortable at all.
No.
Without a transplant, doctors think that Giuseppe's heart will fail within a year.
To be told that I needed a transplant was confronting.
And that's still our goal or aim. That's where we want to get you.
His only hope until a donor heart becomes available is the artificial heart.
The left ventricular assist device, when that's implanted, all those things should improve. Now, don't be alarmed because it looks big, but it actually is really, really small, and you can feel it and touch it. It's a battery-run pump that's implanted into the heart that takes blood from the heart. They put the ring on the heart, make a little hole, and then that goes into there and then circulates around the body. So that part goes into the heart. You don't even see that.
All under the skin.
All under the skin. So you won't see it or feel it. It's there. It offloads the heart and you reduce the heart failure symptoms so people can become medically much better. So in this bag is the little computer and the batteries that runs the pump.
Yeah.
You like a man bag.
Handbag.
It's a whole process that they go through to adapt to this, to come to terms with what happened to them. But you just have to work with them and just support them. Cross shoulder. Just recognizing that it's human beings we're dealing with. It's not a disease process. It's not a pump. That underneath all of this is a human being.
I'm getting weaker, right? And if I didn't do something like this, I'd only get weaker. If I get weak to the point where they can't do a transplant, then I'm done for, you know what I mean?
We don't want to lose him yet.
Okay, you're gonna cry.
Where there used to be a narrowing 75%, that is now blocked.
Across town at the Mater, Tony's artery operation is off to a bad start. The blockage is a lot worse than expected.
What we have now is not only just a narrowing, but we've got thrombus.
Thrombus means there's a blood clot. Dr. Dubinek's priorities have suddenly changed.
There's a risk of parts of that thrombus shooting off and going up into your lungs, brain.
They need to remove the clot plus repair any damage, with Tony exposed to X-ray the whole time. This is going to take much longer than planned.
If the situation changes rapidly, it can get quite stressful.
And now the problem with thrombus and fresh thrombus is it's very fragile, and we can cause it to trash down her left leg.
On this clot, it can actually damage the artery quite a lot.
Because the clot goes about 20 centimetres down her leg, we have to treat the entire artery, which is much bigger and harder than the original procedure which was planned.
We're going to have to use other methods to be able to restore flow back to her legs.
We'll need the longer JB1, please.
You're sort of a little bit more under the pump now because you're trying to get everything ready, get the machines in, get the catheters open.
Red is urokinase, and that's our drug that we're going to deliver into the clot.
This is injecting that drug through our clot. It will help us break it down and get a better result when we go to suck it out with this same machine through this catheter.
There is the chance that this, will not work for Tony.
The most important thing now is a little bit of time. We'll put a drug in and we'll let it start to eat into the clot, and then we'll suck it out.
In surgery, the vascular team is waiting for a drug to start breaking up the clot in patient Tony's leg.
There is the chance that this, will not work for Tony.
After several anxious minutes, the news is not good.
We've just done an angiogram run to see if there's been any effect with the urokinase, and there hasn't really, unfortunately.
Okay, ready?
Yep.
Plan B is much riskier. They will attempt to suck the clot out.
We can only use this for a certain amount of time, so we've got to be very directed about where we want to use this device, because it not only sucks out clot, but it can break up red blood cells and release toxic substances to the kidneys. I think that's enough. Let's just see.
The surgery has already gone 3 times as long as planned, under X-ray the whole time. Dr. Dubinek is satisfied he's removed enough clot to go back to the job of scraping out and widening the artery.
He's about to use an atherectomy device, so it's a little motorised instrument, and then that just sort of eats the plaque.
We're just basically drilling out the inside of the vessel, trying to create a bigger channel at the beginning of the artery.
We'll have to see how this goes, but we might have to use a balloon to open up the artery further. If there's still some disease there, we might need to use a stent too.
Stents contain nickel. Tony is allergic to nickel. It's not ideal, but Dr. Dubinek may have no choice.
All right, let's stop there. Over the wire, let's take some pictures. There's that narrowing, which we've opened with the atherectomy device, and now we're just massaging the rest of it against the wall and smoothing it out. However, we're still left with some narrowing at the top and some small linear tears, which we call dissection in the vessel. In that state, we would actually place a stent to make sure that doesn't happen. If we can stay away from a stent, it would be in Tony's best interest.
Level 9 south of St. Vincent specialises in haematology.
All right, lovely Amanda, I got you your morning tablets.
And is home for many patients going through treatment of cancer and blood diseases.
I promise, I have been told that my little belly injection is quite good.
Oh, good.
My role as a nurse is to make sure that my patients get to be the best version of themselves today and give them the best chance at a tomorrow that's never promised. You give me a call if you need anything, okay? Under all the treatment and under all the disease and the diagnosis is a person. Another chemo today. Do you have any question for them? My name is Jasada and I work as a cancer care nurse at St. Vincent's Hospital. The nuns would be proud of the way I make my beds.
Jasada is preparing a room for a new cancer patient who is about to arrive.
So we've got a young guy, 22, with the new lymphoma.
Oh, really?
Yeah. Yeah.
Treating young patients with cancer touches a nerve with Jasada.
I've known now for maybe about an hour or two that I will get this young person. Obviously, there's been a little flashback, and I think, where was I when I was that young person? But all I know now is that I knew he's coming and I can do it.
22-year-old Luke is a newly diagnosed patient. He's being admitted to the haematology unit where his treatment will begin.
They are pretty confident that Luke has a diagnosis of Hodgkin lymphoma. They have said here that, you know, it's in the intermediate stage and most likely will start chemo within the next couple of days. Hello, my name is Jay. I'm going to be the nurse looking after you this afternoon. Okay, look at those hair. I'm a bit jealous.
I just can't, so I'm confused.
Well, you got to take all the photos you can now. I was diagnosed with cancer when I was 17 years old. You at uni or anything at the moment?
Yeah, I graduated last year. Actually, the day I came in to the hospital, I was on my way to a job interview, so...
Yeah. It was 8 o'clock in the morning. Mum got a phone call from the GP and they told her that I have to go to the hospital. I went straight to emergency room and by 10 p.m. I was diagnosed with Burkitt's lymphoma and I was admitted as an inpatient. I'm always going to have a soft spot for the young people. I've been there, I've experienced it, and I know how hard it truly is. Just having that conversation with him and kind of see where he's at, I can't help but think, oh my God, that was me. And I was so lucky because I went into remission halfway through my chemo, which means that treatment worked and all of the disease is gone. All right, I'll get you to maybe lie down if it's more comfortable for you. Yep. All right. Chop sting. Done. Thank you. When you're going through something like this, it's so important to hold on to the hope.
You know, things will work out.
Yeah. And we only can take it day by day, don't we?
Exactly, yeah.
Yeah.
Oh, this is like
The way that I kind of set this wall up is not to tell my patients about my experience with cancer. It's something quite close to me, and it's something that is probably quite raw, and I don't want that to impede on my care to my patient.
I have been applying for, you know, graduate programs and stuff next year, so like, it's not like it's putting a stop on my life.
No, that's a very good outlook, man. No, that's really awesome. So give me a call if you need anything. Thank you. He had these great hopes and dreams of getting a job and working for the government, but unfortunately things has not worked out that way. But we only can do what we can do, and I just hope that he will be okay. Yeah. And we'll take it day by day.
Cancer clinic nurse Jasada is back at work to hear some positive news about patient Luke's treatment.
He had his first couple of doses of chemotherapy with us here in the hospital, and now he's being treated as an outpatient, which is really great, especially for a young person to be able to have treatment available outside of the hospital grounds. Certain types of cancer or treatment can be given as an outpatient just because of the way the cancer responds to the chemotherapy. I think it's a very, very good outcome for the young man. Being 22 and having his whole kind of life thrown by the word cancer and the diagnosis, I think it's important to have a little bit of normalcy.
Whilst it's early days for Luke's treatment, another one of Jasada's patients is an elderly woman well into her battle with cancer.
How are you feeling today, my lovely?
Not good.
Not the best? Okay. You're doing well? Yeah.
I can't take it anymore.
I know it feels like that. Let's just try to focus on today, okay? Don't focus too much about what's going to happen, right? Because then otherwise I think we'll drive ourselves crazy, isn't it? Yeah? We have those kind of conversations all the time with our patients. It's never really a comfortable conversations to have, I think. And I always feel it's a bit like, you know, kind of thrown back by it because you don't know what's the best thing to say. But I think the most important thing is probably just being there, listening. You've been fighting very hard for the last couple of years.
It's still the same. I'm going to die.
We all feel like that, you know. Well, you're here now, you know. We all feel like that, you know, especially when we have fought for a very long time. And maybe today it just feels like it's the worst day and you feel defeated. And it's okay for you to feel that, right?
I cannot take it.
This is the most vulnerable time in anyone's life, is being in a hospital. And as a nurse, you also have to be quite vulnerable, but also you need to be strong, really strong for the patients. She's having a very difficult day today. She feels as if nothing's really happening and she can't really see that she's improving. I know you've been in the hospital for a long time as well, and it's okay to feel like you don't want to go through with treatment, right? But we just got to take it day by day.
I just want to go. I'm tired.
You do feel it all and you do see it all. You always see the good outcomes and you always see the not so good outcomes. And I don't think too much into the future. I kind of try to, you know, focus on the now. I try to be in that mindset where you might not be here tomorrow, so who do you want to be today? I want to see you smile by the end of today.
I'm always smiling.
I know, you're always smiling. What do I want to achieve out of today and who is the best person that I can be? Not only to myself, but to the people around me, to my friends, my family, my patients. And that, you know, was definitely shaped by my experience with cancer.
I'll see you downstairs and I'll see you later. All right. Thank you.
Father of 3 Giuseppe needs an LVAD, a mechanical heart pump inserted to keep him alive. Over the next 5 hours, a team of 2 surgeons and 6 nurses will perform the life-changing surgery.
The mechanical support, or the LVADs that we do at St. Vincent's, is done as a bridge to transplant. As we know, donor organs is not readily available. The heart pumps allows them to extend their life and wait for their transplant. Are you happy for me to unpack the pump?
Yeah, sure.
Yep. Yeah. Okay. So I'm just going to scrub so I can unpack and assemble the pump and then just run it. The surgeon is very, very quick, so I just need to get going.
A bypass machine will act as Giuseppe's heart and lungs, keeping him alive, while the surgeons operate on his heart. Desiree tests the mechanical heart before it gets implanted.
Now we'll just feel that it starts, okay? And we look at the power, especially the power will go up and then it should settle, which means your pump is working fine. So there you go. There's your pump all ready.
With the pump ready to go, the surgeon can now begin the implant process.
Yeah, green is on.
Attaching the mechanical pump to the failing left side of Giuseppe's heart.
So he's put the sewing ring on the left ventricle and he's taken that piece of the muscle out so the pump can go in.
Okay, red is on, green is off. Yes, so we're sucking in the air into the pump. Gotcha.
We'll be ready to start the pump, so it shouldn't be too long now. We'll be ready to start the pump up.
Done.
This is the riskiest part of the operation.
Still down. Yeah, back up, coming up.
Once they start the pump and the heart and lung machine is switched off.
Yep. 1800, pump LVAD on.
For Giuseppe to survive, the speed at which the mechanical heart pumps needs to be carefully calibrated.
Getting much safer? About 500 mil.
It's a gradual process of starting the pump up and coming off bypass. So you need to balance the two while looking at what the heart is doing, because that's critical.
So should come down to half flow.
Yeah, 2400. If you ramp the speed of the pump up too quickly and come off bypass too quickly, you can go into right ventricular failure.
Increased pressure on the right side of Giuseppe's heart could lead to catastrophic heart failure and death.
Pump's just ticking over, is it?
Oh, that's on 1800. So we off bypass. The pump is supporting him now. Oh, that's a nice echo.
It's working. Giuseppe's mechanical heart should keep him alive and healthy long enough for a donor heart to become available for transplant.
The surgery has gone really smooth and there's been no complications or hiccups along the way.
So you're happy?
Yeah, all good, all good. The VAD is working perfectly fine, so it can be going to ICU.
Good.
Thanks.
As Giuseppe is transferred to the intensive care unit, Desiree gives his wife Diana the cautiously good news.
Surgery went well, there's no hiccups, everything went as planned. He's in ICU, he's stable. All right?
Okay, great, thanks.
Okay. All right, no worries, you can breathe.
Giuseppe's recovery is now the focus.
Good, yeah, great.
1 in 10 patients receiving a continuous flow mechanical heart suffer rejection of the implant.
All the settings is as per normal, but waveform is good, flow is sitting at about 4.
So the next few days are critical to his survival. Back on level 9 South, Jasada has had some sad news. The woman he was caring for has succumbed to cancer.
It's extremely sad and it's extremely unfortunate that she passed away the way that she did. I'm grieving. You know, every day I come into work and you try to match people's energy and you try to be there for all of our patients, but deep down you're still a person who feels and a person who gets hurt when someone passes away, especially someone who have tried their hardest.
When someone passes away, you always feel the sense of grief, extreme grief. I always go home and I kind of sit with what just happened. There's a nursing side of me to make sure that this patient have the best chance of life. But there's also the human side of me that is just upsetting that a life is lost.
There's that narrowing, which we've opened with the atherectomy device.
In surgery, Dr. Dubinek has made a tough call. He'll insert a stent to keep thrombosis patient Tony's artery clear.
In that state, we would actually place a stent to ensure that doesn't happen. And I think we need to do that to the top part of the vessel. So we'll open up the 25 centimetre. We will cover from the top of the vessel all the way down. It's essentially like creating a little bypass and lining that bypass with a smooth lining that's not thrombogenic.
It's just a self-expanding stent. So then this will stay in her arteries. The bits of the artery that have sort of dissected, this will just help keep it in place.
There's the beginning of our stent. It's quite long, so we'll go down and watch where it goes. Now, the most important thing here is that I place it right at the beginning of the artery.
While Tony's allergic to nickel, an allergist has pre-cleared Dr. Dubinek to go ahead if necessary.
Actually see the preferential flow going down her leg through that newly opened vessel rather than the side branches, which is a really good sign.
Should have flow all the way down to her foot. She should feel like a new woman.
That's great. It looks really good. I'm very happy with that.
Tony's surgery has gone really well. So you can see from the x-ray that flow has been restored down to her femoral artery.
She have a nice pink foot, which we do. Beautiful brisk capillary return. And I can easily feel a posterior tibial artery, which is bounding.
The best bit of the case when the lead comes off at the end.
It took a little bit longer than expected, but we got a really good result in the end. And Tony will hopefully be up and walking tomorrow. So yeah, all good. It's all gone to plan, so that's good.
You okay?
It's been 3 weeks since Giuseppe's mechanical heart implant surgery.
I'm just going to see Giuseppe. He's actually going home today, so I'm just going to make sure he's got everything he needs. Hey, Giuseppe, look at you. You look great. You're all packed up and ready to go. You've got your medications. They've given that to you.
In my bag there.
Excellent.
In the future.
And you've got all the equipment.
Yeah.
Do you want to put those last bits in, or do you want to wait till Diane gets here?
No, I'll do it now, but there's going to be a few trips to the car.
He's doing amazingly well. You can imagine 3 months down the line when he's had time to build up his muscles and just do some more rehabilitation, he'll really feel the benefits. And his quality of life is the thing that's going to change, and it will be much better.
Huh?
You excited?
I know. It's worked out okay. Now I'll get home and see how we adjust them.
Yeah. I'll be a mule.
Giuseppe still needs a heart transplant to survive. A donor heart could become available tomorrow or in 18 months. In the meantime, his mechanical heart will do the job.
See you next week.
It's hard to imagine to get to this point that we're here now, so I'm excited. Because I'm skinny now.
Oh, how much weight did you lose?
From 80 to 64. What's that? Almost 16 kilos.
It's all right. Italian cooking will get you back up there.
I'm sure you will.
I'll wait for my first plate of pasta. Desiree gave me the confidence to trust him, to not worry. And that was great.
I think if you said this to somebody 30, 40 years ago, we're going to put a little pump into you, you're going to have a battery pack that you carry over your shoulders, and you're going to go home, and you're going to live your life. It's amazing engineering and technology.
It's been 5 weeks since I've walked to the hospital. Now I'm walking out.
So nice to see them going home, looking well, feeling comfortable. This is the first step improving the quality of life while he's waiting for his transplant.
See you next week.
Well done.
Desiree.
You know where I am.
Yes, thanks so much.
Okay, you did well. He's done perfect.
Yes, hasn't he?
Be
All right.
proud.
Bye-bye.
Bye.
At the Mater, Nurse Phoebe pays a post-surgery visit to her patient Tony.
Hello, Tony.
Hello.
Hi, how are you going?
I'm well, thanks, Phoebe.
After only 2 days, Tony is up, walking and ready to go home to her family.
Look at me walk.
Oh, this is
all
just
good,
the
yeah?
best.
Yeah, it is. It is.
How's it all going?
No, it's great.
Have
It's
you
great.
got any pain today?
No, no. I feel like me. I feel happy. Yeah, yeah.
This is the best.
Yeah.
Steve will be so pleased.
Yeah, I know. I'm so pleased too to be able to get
wow,
back
give me a walk.
to. Shall we go?
Yes, let's go for a little walk. It is super satisfying seeing that.
Look, I'm just like me. It's just
wow.
Yeah, it's fabulous.
Yeah, she's definitely a different woman. Well, it certainly makes it all worthwhile seeing you this bright, this happy.
You've been so.
Tony.
You've been really gorgeous. You have. Honestly.
I would look after you any day. Nursing is just the best job in the world.
Thank you very much.
Mwah.
Take care. Bye, Phoebe.
You see people on their worst day, but you know what you're doing is to help them. It just becomes part of your DNA. Wally?
Yeah. Thank you. Cheers. It is a rewarding job, and it's always nice to know that you've helped somebody. You were there for them, and you held their hand when they were going to sleep, and you were there when they woke up. Yeah.
Let me help you.
You do get to know these patients very well. It's a long journey. Morning. You walk the journey with them right from the start. We're just waiting for that call for your transplant. It's a very satisfying job.
Life will throw you a bad bone every now and then, and life isn't always an easy walk. But human beings, we're so resilient. The greatest joy of being a nurse is you have made a big contribution to the world, and you know that you have made someone's day. You know what I mean? Yeah.